How to hide cuts. Perhaps you have cut yourself shaving, or your knife slipped while working in the kitchen. Accidents can produce cuts you would prefer to hide. There is also a possibility you've cut yourself intentionally. If this is the case, having others notice your cuts may heighten your stress and emotional turmoil. Proper treatment of the wound itself should always be your first step in minimizing the appearance of cuts. From there, you may try a variety of tactics to hide cuts on your body and face. If you're engaging in self-harm, it is always important to seek help. You are a person of value and worth. Method 1. Treating the wounded area. 1. Assess the wound. Is your cut less than 1/4 inch deep? Did it come from a reasonably clean source such as a kitchen knife or your razor? Are the edges fairly straight? If the answer to these questions is yes, you can probably treat your cut yourself. See a doctor for treatment if your cut falls into any of the following categories. Large areas of skin have been torn, the cut is jagged or gaping, or you can see bone, tendon, or muscle in the cut. The cut is a puncture wound, or the object that cut you was made of rusty metal. You will need a tetanus shot if it has been more than 5 years since your last booster. You are unable to remove all dirt and debris from the cut. The cut is from an animal or human bite. The area you've injured feels numb. 2. Wash your hands thoroughly. Cleaning your hands with warm water and soap will help prevent infection. Consider donning disposable protective gloves if you have some available, and especially if you are treating another person's injury. 3. Apply pressure to stop any bleeding. Most minor cuts will stop bleeding on their own. If this does not seem to be happening right away, use medical gauze or a clean cloth and press firmly on the wound until the bleeding stops. Note that cuts on your hands or head may bleed more heavily than elsewhere due to the extra blood vessels present in these parts of your body. Seek medical assistance if you are unable to stop the bleeding after a few minutes. 4. Rinse the area with clean water. You can wash the area around the cut with soap and water. Avoid getting soap into the cut itself, however, as this can cause irritation and discomfort. Avoid using hydrogen peroxide, iodine, or rubbing alcohol to rinse your wound. Medical professionals have determined they are not necessary, and they can irritate your injury. 5. Remove any debris. Rinse a pair of tweezers with rubbing alcohol and then use them to remove debris particles such as gravel or splinters. 6. Apply a topical antibiotic. A thin layer of antibiotic ointment will help protect the wound, discourage infection, and keep it moist for more effective healing. Note that using antibiotic ointment will not actually speed the healing process. Some people have skin sensitive to the ingredients in antibiotic ointment. If you notice a mild rash, discontinue use of the ointment. 7. Consider using a liquid bandage. If you have liquid bandage handy, it's a great way to seal up cuts and scratches and keep them from getting infection. Bring the sides of the cut together with your fingers and apply liquid bandage evenly over the cut. 8. Cover the cut. Use a bandage, medical gauze, and tape, or a liquid bandage product to cover your cut. This will keep it clean and help you avoid infection. Minor scratches or scrapes may be left uncovered, as exposing the injury to air will aid in healing. Liquid bandage products seal your cut after one application. They are applied by painting the bandage solution over your thoroughly cleaned cut and allowing time for the solution to dry and form a seal. Liquid bandages are waterproof and will last several days, falling off naturally as the cut heals. Avoid rubbing or scrubbing the side of the bandage. 9. Change your bandage regularly. This should be done at least once a day, or whenever the bandage gets wet or dirty. If you are allergic to bandage adhesive, consider using paper tape, rolled gauze, or a loose elastic bandage. 10. Keep an eye out for infection. If you notice swelling, unusual firmness, redness, red streaks, warmth, or drainage in the cut area, see a doctor. These are usually signs of infection. Method 2. Covering up cuts on your body. 1. Wear long-sleeved shirts or pants. If you have cuts or scratches on your arms or legs, long-sleeved shirts or pants are an easy way to hide them without looking too obvious. Women may consider wearing thick tights under skirts. During the summer months, consider lightweight garments and cover-ups such as lace tops, burnout fabrics, maxi skirts, capri pants, or surfer shorts. Wear a clean bandage under your clothes to keep them from rubbing and irritating the cut. 2. Wear bracelets or a watch. If you have a cut on your wrist area, a chunky bangle or watch will help hide it. Wear a bandage under the jewelry to keep the cut from getting irritated. 3. Use makeup to cover minor cuts and scratches. If you have shallow scratches or cuts on your arms or legs, such as those made by a cat, you can use makeup to cover them up. Select one that has yellow and pink undertones for the best match. You can use a liner brush and concealer that's a little darker than your skin tone to dab the makeup over the area. Don't use makeup on a fresh wound or a deep cut, as this can cause infection. 4. Make your bandage a fashion statement. Purchase bandages in fun prints or patterns to hide your cut in plain view. A favorite cartoon character or print might help boost your mood, as well. Method 3. Covering up cuts on your face. 1. Rinse the cut with cold water. Don't use soap and don't rub your face with a washcloth, as the skin on your face is usually very thin and irritates easily. Instead, gently splash the cold water on your face. 2. Apply an ice cube to the area. The cold will help shrink blood vessels and allow the cut to stop bleeding. Eye drops such as Visine may have a similar effect. 3. Apply lip balm or Nick gel to the cut. While shaving Nick balms are available for purchase, basic lip balm works as well. These products help seal the cut and prevent it from getting infected. Allow this to dry for a few minutes. Use an unflavored, uncolored lip balm for best results. You can also use unscented petroleum jelly. 4. Apply concealer to the area. Pick a concealer that's either the same shade as your skin or a shade lighter. Use a Q-tip or liner brush to gently dab concealer onto the center of the cut. Blend the concealer by dabbing the brush onto the cut, or use your finger to blend the concealer outwards, towards the edges. Set the concealer with powder. Pick a translucent or colorless powder so that you don't draw extra attention to the area. Use a puff or powder brush to dab the powder over the cut, then blend using sweeping circular motions. Method 4. Using topical products that minimize scarring. 1. Use sunscreen. A sunscreen with zinc or titanium dioxide will block the UVA and UVB rays that can cause any scar from your cut to develop hyperpigmentation or excessive color change as a result of sun exposure. 2. Apply petroleum jelly. While various companies sell expensive creams proclaiming that their ingredients will reduce scarring, there is little evidence that these vitamin E or cocoa butter-based products work better than simple petroleum jelly. The key to reducing scarring is keeping your scab moist, and petroleum jelly accomplishes this well. 3. Consider purchasing silicone gel sheeting. This product is available at many pharmacies and is applied daily. Bear in mind this is not a short-term solution. Silicone gel sheeting should be used at least 3 months to produce optimum results. Method 5: Coping with self-cutting behavior. 1. Understand why you might be cutting yourself. Self-cutting behavior usually emerges during your teen years, though some kids begin doing so as early as age 11 or 12. Recognizing what causes you to cut might provide some hints as to how you might seek help. Powerful, overwhelming emotions. Does cutting feel like the only way you can express or interrupt feelings that are too overwhelming to ignore? Do you feel pressure to be perfect, or like you can never measure up? Do you feel others are placing you under unbearable pressure? Does cutting help you feel pain that comes from other trauma in your life? A need to focus pain on something specific and visible. Do you feel like you need to gain control over the source of your pain? Is cutting something that can replace invisible, but very real, inner pain? A sense of relief. Do you feel relieved when you cut? You might be benefiting from endorphins, hormones that are released during both physical exertion and injury. Alternatively, actually seeing the emotional pain you feel may provide you with a sense of relief. Feeling addicted to cutting. Do you feel like you've formed a habit of cutting? Does it take more self-injury to accomplish the same sense of release or relief? Other mental health concerns. Are you experiencing symptoms of other mental health issues such as depression, bipolar disorder, or other personality disorders? Are you experiencing post-traumatic stress? Peer pressure. Are others influencing you to try self-cutting? Are you cutting to win the approval of a friend or to be accepted by a group? 2. Seek help. If you are engaging in self-cutting for any of the reasons outlined, you need to seek treatment. Your health and well-being are important. Speak with a trusted friend or loved one, or consider going to a school counselor or health center, anywhere you feel safe. Develop a quit date, and seek the help of family and/or friends in holding you to your commitment. Substitute positive behaviors. If you find you experience a sense of relief through cutting, for example, lace on your running or walking shoes when you feel the urge to cut and get outside for some exercise. Can you replace the endorphin rush of cutting with the endorphin rush of jogging? If friends are pushing you to cut, remove yourself from this situation by joining a new club or activity. Obtain therapeutic treatment to address the underlying factors contributing to your self-cutting behavior. Your therapist will help you understand why you're cutting and work with you to find better ways to cope with your sources of stress and emotional turmoil. They will also be able to diagnose underlying mental health conditions that could impact your desire to self-harm. Consider a self-harm rehabilitation center if you're really struggling with this medical condition. You'll find support and friendship in this group setting and develop valuable coping tools. 3. Recognize you have great worth. It's vital that you commit yourself fully to overcoming your self-cutting behavior. Your therapist can help you develop positive coping behaviors and tools to recognize the many wonderful attributes you bring to this world. You are a valuable person.